Good afternoon, everybody, and welcome to our webinar, The Evolving Landscape of Learning, where we'll be looking at how to rethink learning design in the wake of the pandemic and how we can nurture a culture of engagement moving forward. Oh, my apologies, I think my video is off. Hopefully that's come on now. I'm Paul Walker and I'm the Chief Technical Officer at Skills for Health, and I'm delighted to be hosting today's webinar that showcases our intuitive and customizable learning management and compliance system, LearnSpace, and we'll also be exploring some of the wider themes around learning design and the technologies that can support that, along with our learning team here today. At today's webinar, our learning technologies experts will share what they've learned about learning during the pandemic and explore how that has evolved to meet those needs with the changing landscape. We also have our principal consultant in leadership management and organizational development, who'll discuss getting back to basics in terms of creating a positive learning culture. So just a little bit about our organization. Skills for Health work closely with the healthcare workforce, focusing on training and development needs. And as a not-for-profit organization, every penny we earn is reinvested back into our products and services for the benefit of the end user. We've been involved in delivering learning into the health sector for over 20 years now, so we have a lot of experience within the health sector, and we understand its needs and particular problems. The learning experience and the work environment have gone through obviously a huge shift over the last couple of years, and every healthcare organisation has had to very quickly adapt their training to meet those changing needs and help support their workforce. We've also seen that through that, some of the technologies that have been involved in the sector have also had to very rapidly change or be replaced to adapt with those different workplace scenarios. Today we're going to introduce you to LearnSpace, which is Skills for Health's e-learning and compliance-based system that's based on the TOTRA platform. For those of you unfamiliar with TOTRA, it's more than just a learning platform. Its latest release combines LMS functionality with performance management and user engagement. So it's a very single, powerful platform. And with LearnSpace, we build upon that to provide compliance and intelligent analysis of your learning landscape. At today's webinar, I'll be joined by several members of our Learning Solutions team, starting with Molly Aspley, who is our Digital Learning Implementation Manager. And she's going to share her knowledge and experiences of helping organisations create sustainable and impactful learning cultures and solutions. Once we've heard from Molly, I'll be inviting several members of the teams to join me in a bit of a discussion about the subject. And of course, we'll leave some time at the end of all of this to take some questions from yourselves, so that we can add those into the panel. So I just want to do a bit of housekeeping before we start. I'm sure everybody's pretty familiar with Zoom now, thanks to the pandemic. But essentially, at any time during the webinar, you'll have the opportunity to submit questions to us. There's a Q&A button at the bottom of your screen. You can use that and type in your question, and we'll look to answer that within the panel session. If we don't get time to do that, don't worry, we will endeavour to answer your questions after the session as well. So you know, don't worry, we will get around to all questions that you ask. We do try to make these webinars as two-way as possible. So obviously, with so many people, your speakers your microphones are muted, but you can engage through either the questions or through the chat function. So if there's something you'd like to say through the chat function, you can add something in there. And if anybody would like to try that out now by typing in their name and where they're from, so we know who you are, that would be very nice. And we'll also be doing some polls during the webinar. And I'd be very happy, very pleased if you could participate in those polls, which helps us get some feedback from what we're doing. At the end of the webinar, it's being recorded, and we will share the slideshow, and we will share a link, so you can watch it on demand if you want to share it with colleagues, or you want to catch up on a particular bit that you might have missed. So without further ado, it's fantastic to see so many people here today, and I'm going to hand over to Molly to take us through her presentation.
Thanks, Paul. And yeah, it's great to have so many people on the call today and from such a variety of places, although windy in most places, it sounds like, just like it is down here in Bristol. But today, yeah, so we'd like, just as Paul said, we'd like to go back and reflect on what we as learning professionals, and particularly in the healthcare sector, have learned about learning over the last 2 years. So what are some of the core pillars of learning management that remain, and what do we see changing as well? And all of this in the context of a world where being responsive to and preparing for change is no longer just a good idea, something to prepare for, but it's becoming core to what we all do in our day-to-day roles as well. So in terms of structure, I'd like to briefly look back at the learning priorities that we were tackling before the pandemic and what this meant for the digital learning solutions that organizations we work with had in place or perhaps looking to move towards. And then how more recent changes and challenges in the ways of working over the course of the pandemic have got a lot of us thinking about learning differently. And we'll look at some of the ways in which expectations of learning and development are perhaps starting to change as well compared to what we did see before the pandemic. And then in the final part of the presentation, we'll explore some more practical advice for designing and delivering learning to meet these new challenges and these changing expectations from our stakeholders, including, of course, the inevitable move towards digital learning and the importance of well-designed online and blended learning experiences. Throughout the presentation, just like Paul mentioned at the start, we'll be introducing the audience to LearnSpace, which is our learning management solution based on the Tatara experience platform that brings in together complete LMS, collaborative workspaces, and also complete performance management system as well, all in one platform. So and through Tatara and through LearnSpace, we're supporting organizations who are embracing digital solutions to support not only in the learning, but also in the engagement and the performance of their people. So we'll return to looking at LearnSpace a bit more later on. Just before we do get started, we'd like to start with a quick poll. And that question will be coming up onto your screens. So it's just a simple yes or no answer, a bit of a pulse check. Has your learning and development strategy changed in the response to the pandemic? And if you'd like to tell us how perhaps your learning strategy has changed, perhaps how it's not changed as well, or the extent, what you've seen changing in the chat as well. I would love to hear your experiences, but we'll give you 30 seconds or so just to share your thoughts and your experience through the poll there. Okay, thank you everyone. So we just closed the poll and we can see, very interestingly, 97% of you have answered yes, that you have seen your learning and development strategy change in response to the pandemic. And I see the responses coming through in the chat as well, moves to Zoom, Teams, these virtual platforms, and blended learning as well. And that really does correlate with a lot of what we've seen at Skills for Health and what industry research has indicated as well. Actually, it's interesting that a Fosway report done back in May 2020 showed that 94% of learning and development professionals had seen a change in their learning and development strategy. So it's interesting that we've got very similar figures in our poll as well. And at that point in time as well, in the Fosway report, only 5% of learning and development professionals thought that their learning strategy would actually go back to what it was before the pandemic began. So yeah, interested to hear your thoughts. Do you think learning and development will ever be the same again? Yeah, as I said, continue to share your thoughts in the chat box as we go through the presentation. But let's get into it. And we'll firstly consider, so what do we do as learning and development? And at Skills for Health, what are some of the challenges that healthcare organizations speak to us about day to day? So the first common theme we see, and we saw before the pandemic, is how do we understand, categorize, and manage our people, their job information, their management lines, and their compliance, importantly. And that's characterized, of course, by this core focus on statutory and mandatory training, creating meaningful inductions, and tracking of role-based competencies. And one of the main challenges we see learning and development teams face with day to day is defining that training matrix. And I'm sure you've all got your own ways of describing this. And we need tools for keeping this matrix up to date and for putting it into effect as efficiently as possible through whatever medium learning is being delivered. And that's where automated systems for managing learner onboarding, course enrollment, repeat certification are really powerful, especially where you do have such complex job role hierarchies that are changing all the time. And then the second set of bullet points there, so courses and content. Second to managing your audience of learners, we want tools for managing our learning content. That's our courses and our programs, be they e-learning catalogs, our development programs, apprenticeships, professional qualifications, and CPD. And we speak to organizations regularly about using digital tools like LearnSpace to support in the delivery of programs, all the way from courses to prepare international nurses to take their OSCEs, to delivering HR training programs for line managers. And these programs we see being delivered sometimes as standalone courses or a series of courses. But mainly focus on delivering content or providing content for learners to work through to impart knowledge and develop their skills. So there's a lot that we do in L&D and that we're delivering all the time. And we know that these types of programs have an important role to play to address long-standing challenges in the sector, things like recruitment, like talent succession, retention, leadership development, and supporting individuals through their careers with you. And so my final point before we move on to look at some of the more recent changes we've seen in learning is that ever increasing importance of evidence-based practice in learning and development and using data and analytics in our work. So as L&D, we're all the time looking at how we can connect the right people with the right information and the metrics that they need to design, deliver, continually improve on our learning initiatives. And that's why we've done a big push ourselves at Skills for Health on our reporting capabilities in LearnSpace over the last 12 months with things like improved compliance reporting dashboards and supporting organizations with integrating their learning and training data with their HR information and other people data as well. And we recognize that for most organizations, these are all ongoing challenges. Maintaining an up-to-date training matrix, managing your people records, developing your digital tools and reporting systems. And we'll be interested here in your experience as well. Why can efficiencies in learning and development and this core practice sometimes be so hard to achieve and to get right? But these are the learning management practices that characterize a lot of what we see at Skills for Health and what we saw before the pandemic. And all of these programs and the effort that goes into delivering, maintaining and reporting on them is important and very valid. But even before the pandemic, we definitely started to see a gradual shift towards leaders thinking more holistically about learning, in bringing learning closer to work rather than separate from it. And starting to question some of these more traditional approaches. But in a lot of cases, sort of held back by the traditional expectations of what workplace learning looks like and what the learning and development team do. We'll come on to explore some of these ideas a bit more later. Just before we do, so let's have a look at some of the more recent challenges we've experienced during the pandemic, because I think the way we've seen our working lives change is, I think, inseparable from how we're seeing learning and development start to shift as well. So we've seen organizations needing to rapidly recruit, onboard people and volunteers, and we've seen new and reformed administrative teams to be able to enable and support this process as well. And the need for integrated technologies to help deliver a safe and compliant workforce to the front line quickly and maintain them as well. And only recently, actually, at Skills for Health, we've supported NHS professionals, that's a body of bank workers for the NHS, in the National Vaccination 2 programme. So onboarding and training over 3,000 volunteer vaccinators to support in the COVID-19 booster rollout. And this scenario, collaboration between people and the ability for technologies like LearnSpace to speak to each other was crucially important to get that workflow designed right. And that made the difference between volunteers needing to sit something like a half day of training compared to 5 days of training in order to be deployed. And then for frontline colleagues as well, we saw people combining into new teams, working in new places with different people with new responsibilities. And we saw people applying their skills in these new contexts or needing to learn new skills for deployment as well. And in all of this, we saw a real emphasis on communication and team working. So people stepping in to support each other as we adapted to these new ways of working and new kinds of work as well. And there was a lot of learning that came out of these interactions. Remote working. So even in the early stages of the pandemic, but continuing, as we all know, as a longer term trend, we've got people working remotely and we need creative solutions to these new problems. So we saw teams using leadership, agility to put solutions into place quickly. An obvious example, like you've mentioned, shifting training programs onto Zoom overnight. It was never going to be that perfect solution, but it really did tackle an immediate need and provided a basis on which to continue to better that experience. That links into my next point, which is around changing expectations of digital and of technology. So moves towards digital transformation have been happening for a long time, but a key change for us has been in attitudes towards digital and people becoming a lot more accepting about adopting these technologies. And that's because we've all been through this experience where having access to information and to each other and to resources quickly enabled by technology really helped our people adapt as well as they did during the pandemic. And we work, for example, with several university, nursing and midwifery faculties who've made huge shifts in how they use learning and development systems over this period, and who've come to understand and appreciate that as complex a process as it is to ensure their students are safely trained and compliant in order to start their placements, there are now tools and technologies that understand all these intricacies and are flexible enough to facilitate that training and that deployment process. So we saw all of these things colliding at the same time. So some huge challenges that we had to rise to during the period, and we're just touching the surface there. As we continue to do so with these challenges. But what was clear for us, even early on in the pandemic, was that learning and development teams had a real amazing opportunity here to learn and to rethink how learning was being designed and delivered at the same time that our people's own expectations on how learning happens were starting to change as well. So what do I mean by this? And I've summarized some of these trends into 4 themes. So firstly, a greater appreciation for learning as a social group activity. So we see learning being appreciated more and more, and not as something that's delivered. Content is delivered, but real learning is ongoing, and it takes place when we connect with one another, when we reflect and we put new ideas into practice. So expectations on L&D are starting to shift. We're being expected more and more to facilitate social learning at work by providing the tools and the spaces and the trust within those spaces for the culture for social learning. We're also seeing a greater appreciation for getting resources, so learning materials, out to people quickly to help them get their jobs done. And so learning and development teams are being expected to curate more resources rather than create courses as the first approach. Actually, in the same Fosway report that I referenced earlier, the 4 types of content that were rated as most successful in supporting organizations through COVID-19 were video, curated, mobile, and micro-learning, more so than bespoke e-learning or off-the-shelf sort of content. So, L&D are expected to get these materials out quickly and then to learn fast what's useful, what's helpful, to improve on them and respond to that continued change. So a much more agile approach in learning and development. And as I mentioned before, a greater appreciation and understanding of digital tools for connecting people together and information across geographies. So learning development teams are now expected to have digital skills and to be able to provide adaptable, integrated learning solutions quickly, and be able to support people around using those tools as well. And then the last point there, this is really important. So on an individual level, we saw changing expectations or starting to move from our own people around their individual careers and their personal development. So we know that the feeling of purpose is already a very strong motivator among healthcare professionals. But we saw learning and development exploring ways to connect individuals to that motivation in such challenging environments, of course, we saw during the pandemic, and to continue to offer opportunities to our people to master their skills and perform in their roles. So really recognizing that providing opportunities for learning can be the difference between an engaged employee and one who is not. And significantly, that a meaningful experience at work is going to mean different things to everyone. So learning as an inherently social experience, a new tendency towards resources over courses, renewed attention to flexible, well-designed digital tools, to support people through these changes, and learning being reconnected with that very individual employee experience as well. So a lot of change, and these changes being experienced at different levels across the sector as well. And it's through our partnership with Totara that we're really pleased to be supporting some organizations through these transitions and equipping them with an adaptive toolkit for meeting some of these new expectations and other changes as well, to apply learning from the last 2 years. While at the same time to continue to address all of those core learning management needs that we looked at the beginning, which of course aren't going anywhere either. So what I'm not saying is that learning technologies are the only answer, but I do think they're an important part of the equation. So I just want to share some practical guidance on the actions you can take to harness digital tools and adapt your processes around content to really impact your learners and to facilitate these valued learning experiences for the audiences that we serve. So the point I'm really getting to is rethinking the idea of a course, which in my experience, I think a lot of us want to move away from, but we're not always sure how. And I really like this quote from Laurie Niles Hoffman, which I think demonstrates the point well. One of the ways we've seen learning teams trying to respond to this change is through this Netflix of learning approach. So remember, which is sort of like a course catalogs of content. And remember, while Netflix is great at recommending you things, its business model is to keep you watching and to consume your time. Whereas as learning professionals, perhaps we actually have the opposite goal, not of getting you to the answer, not of consuming all your time and binging on content, but getting you to the answers and the guidance that you need quickly, and then getting out of the way to do what you do best and what you know how to do best. So is this Netflix of learning sort of approach and pushing content really the best way to help our people and to help our organizations? So one of the ways we've seen this change manifest itself is this move away from knowledge packed up into courses, maybe with an assessment at the end, towards a more resources first approach, be that a video, an article, a podcast, or an infographic, which can be extremely powerful. So with resources like these, whether they're curated or created in-house, you can stimulate thinking, encourage practice, not in 6 weeks' time after I finish my program, but now, immediately, and get people to the answers that they need quickly, where that's appropriate. So it's less about the learner consuming content and then demonstrating what they already know in a quiz, to actually learning how to do something differently and adopting that new skill or behavior. And by all means, you can structure these sort of activities, like videos, like infographics, articles, into meaningful courses and longer programs, but they can also be used in isolation. When I encounter that new challenge, that new scenario, or when I have that question and I don't have someone to turn to. One of the really valuable things about a resources first approach is that you're respecting your people's time and their intelligence and what they already know. So you're shortcutting them to the answers they're actually looking for, and also respecting your time and integrity as a learning team as well, by questioning, does this request for training or this problem actually need to be an hour-long course? And so this sort of leads on to my next point, and another important element to factor in your digital solutions, and that's choice. And this goes back to the importance of individual motivation and curating true learning experiences. So what we see is more learning and development teams offering choice in the learning activities rather than prescribing certain pieces of content, be that through a platform which offers self-registration options for different activities, or through offering programs with different pathways to achievement. So, and this goes back to the point before about respecting your audience. What do they already bring, and what can you take about what you know about your learners? So that's data, and shortcut them to what is relevant to them. Respect what they already know. And some of you may be thinking, we can barely manage to get one course out there on a certain topic. There's no way we could have the time or the resources to provide different options for accessing that same piece of content. But this is where a resources first approach is so valuable, in that it frees up your time to create these more immersive and personalized experiences where your bigger challenges are. and where a longer, more interactive experience is more appropriate. And there's lots of tools out there if you're quickly putting together these different pathways that enable you to create courses that adapt to your learners' interests, their previous knowledge, ability, or engagement with other activities as well. So the tools out there to help you do this. And so continuing the theme, designing for digital. So designing learning in a digitally enabled world means doing just that, designing for digital and appreciating that mobile and desktop experiences are each unique as well. So it's not all the same. For example, you can immerse a learner more effectively in a larger desktop interface and more easily present more challenging scenarios or sort of activities where they need access to other supporting information, either within your learning management system or elsewhere, not on the internet. Whereas on a mobile device, you might want to think about different types of media, things like podcasts and videos or shorter assessments or your mobile apps. So we need to bear in mind the environment in which learning is taking place, because this will influence how a learner engages with your content and also therefore the value and the actual learning that's going to come from that. And so all the time we should be removing distractions, removing obstacles as well to digital learning, which is obviously challenging in busy healthcare settings. But what do I mean? I mean, getting out of people's way when it comes to online learning. So taking the time to get to the root cause of technical and accessibility issues and providing real practical help with things like browser and device problems, and ensuring that you've got the skills in your teams as well to be able to do that. So in my experience, I think sometimes it's easy to think of online learning as something that looks like this, comfortable desk setup. It's 3 p.m. and I finished my training already and I've got my certificate all printed out. I'm not ready to deal with the times where online learning looks more like this. And so I think digital really is all of our responsibility. And having made the transition myself from working in a very traditionally minded learning and development team in the social care sector into now implementing cloud hosted and integrated learning management systems, I've experienced firsthand how having just a little bit of knowledge on your technical infrastructure can go a long way. So it's about having that relationship with IT and your learning providers as well, and asking the right questions. Importantly, what does it mean for my end learner experience? And sometimes, this does just mean sitting down with an individual and asking them to show you what they're trying to do on the platform and not making assumptions, and then applying this in your future design of your platforms and of your online learning. So I've spoken a lot about changes in learning today, and there's just 2 more feature areas of LearnSpace that I wanted to introduce you to before we do end, because I think they touch on a lot of these topics and bring it all together. So the first is Tatara Engage. So this is the LearnSpace module that facilitates curated learning and collaborative workspaces that allow for knowledge sharing across various groups in your organization. And as technology has done for a long time, it removes some of those physical barriers. So people working in different parts of the building or across the country, and it gets them interacting where perhaps they wouldn't have had those conversations before or a few opportunities. So it's a fantastic tool for getting resources out to your people quickly and facilitating user curated and created and curated as well. And people can learn informally as well this way. So it brings in that choice that I spoke about earlier. And by all means, you can bring in these workspaces into your more formal and longer learning programs as well. And then the second is the Perform module for LearnSpace. So it's a flexible performance management system that sits in the same integrated ecosystem as your learning and as your collaborative workspaces. So bringing together the 3 segments of that experience. And Perform can support both traditional and more modern performance management processes by bringing in things like competencies, goals, performance activities, and 360 feedback as well, which I think is really powerful because it brings in that collaborative learning experience I've been talking about. And then with an ecosystem that brings in collaboration and it brings in performance right into learning, you're closing the loop on that whole experience of individual and collective learning, which is really the direction that we see training and development moving towards. And what we're trying to do as learning and development throughout all of this, or what we should be aiming for, is addressing what motivates us as individuals. And the diagram on the screen there is based on the research by Dan Pink that some of you might be familiar with about the theory of motivation. And he says, But in order to motivate us as individuals, and we are motivated by purpose. So having a sense of purpose in our roles, in our organizations, mastery, so having opportunities to master new skills and behaviors, and autonomy, so being provided with autonomous environments in which to practice and use our skills and experience. That's what motivates us as individuals. And that's why we incorporate all these different modules into LearnSpace. So I'll just leave you on the final slide, which is another representation of that platform which underlies LearnSpace. And then I'll hand back over to Paul for the panel discussion.
Great, thank you very much for that, Molly. That was very interesting. Obviously, Molly showed us a number of great features from LearnSpace there, but it is a very big system. There's a lot more to it than what we've touched on there. So I was just going to pop up a quick poll to see if anybody would be interested in having a further more detailed demo by one of our learning experts after this session. So if you could pop in yes if you would, and then one of our team will be in touch with you to arrange a demo. So I'll leave that up for a minute. Okay, we're then going to move on to our panel session, and I'm going to ask our panelists to switch their cameras on and join me here. And we've got John and Alice and Chris coming on board now. I can start to see people. Excellent. If I can ask you to introduce yourselves. So could I start with you, Alice?
Hi everyone. I'm Alice. So I'm the technical account manager at Skills for Health, and I work very much in the learning platform team, so very much in the digital kind of technologies space.
Thanks for that, Alice. Chris?
Hi, afternoon everyone. Yeah. So Chris Burling here, the Principal Consultant for Leadership, Management and Organizational Development.
Great, thanks Chris. And John?
Hello everyone, thanks for joining. I'm John Polak, I'm a Client Director who looks after our existing and future customers on the commercial side, as well as facilitating the support side of things.
Great, thanks, John. Well, thanks for joining me. We've had a number of questions coming in already, so I'll get stuck straight into some of those. John, I'd put this one over to you first, which is we've talked about the changing landscape, but what do we see not changing in the learning landscape?
It's a good question. Thanks, Paul. I think what we are seeing, and we will continue to see always, is live training. We used to refer to it probably as classroom training in the past, and now that the vocabulary is changing, we call it live training because it's not happening in classrooms so much anymore. But live training will continue to be essential, and systems will need to be able to manage that part and bring it together to the online training. So that's going to be an essential thing. Some elements of training will always require that back and forth that live interaction provides. And what I think is important is how you capture and how you manage that part. That's the bit where the systems come in.
Yeah, okay, great. Thanks, John. And keeping on the sort of theme of change, really, do we think things were changing anyway before the pandemic? Alice, what would your thoughts on that be?
I think that the pandemic has definitely accelerated the changes that are being made. You know, like I said a minute ago, for context, in my role, I'm in the learning platform team. And the technology has kind of always been there, as John alluded to. We've always had sort of user management features and competency frameworks, and, you know, courses have got tools inside them to be able to add lots of different resources and things like that. I think what's been accelerated is the kind of need for more like social collaborative learning and the spaces to do that. So the systems that are required in order for learners to go into those kind of spaces so that they can kind of do that kind of learning is definitely required. So there's been a sort of change and a more of a demand, I've seen it in my role, that for more sort of like cloud-based systems and software as a service, and much more sort of data integrations from sort of one system to another, so that, you know, all of these social and collaborative kind of learning methods, like Molly was talking about, can kind of be implemented quickly and efficiently, and kind of in a cost-effective manner. So yeah, I'm definitely seeing like an acceleration in my role with the demand for sort of systems, really.
Okay, and Sue asked a question which links onto this whole path of change, which is how can we tackle admittedly the minority, but still a number of staff members who don't have a high level of digital skills and confidence. I wonder if Chris, you'd be able to answer that one.
Thanks, Paul. Yeah, thanks for the question. Well, I mean, I think this is an issue, of course, and an issue that organisations will have to face as we continue to strengthen, I guess, what you'd call this technological axis of your organisation, where much more time is spent and expected to be spent in this type of environment. The question really, I think, speaks to the nature of learning and how you breed that culture of learning within your organisation, regardless of the skills and the experiences you're trying to craft and create. So how do you learn anything? How do you develop anybody to do anything? And I think partly it's around, for me anyway, in my perspective, it's about creating those conditions. What are the conditions that someone needs to be able to understand, apply and learn the use of digital technology, the use of digital environments? And that requires nurturing the environment. It requires, you know, patience, it requires time, it requires space, it requires high quality instruction, but it also requires the sort of social environment that Alice is talking around, that enables people to find people in their organization that can support them. You know, how do you build those connections? How do you reach out to people? So I think there's a lot of ways in which you can deal with that. And I think it's something that needs to be acknowledged, that not everybody is a digital native, not everybody has an ability to just simply jump on a laptop in this environment, learn, work, collaborate with people, but it's something that can be developed, and organizations, you know, need to invest in that. And you know, certainly Molly was talking earlier, there's a range of ways in which that can be done in this particular tool in these conditions, but it's an organizational culture approach, I think.
Chris, I've seen sort of programs where organizations have sort of digital champions in a way. So they are just colleagues and volunteers or anyone really who is kind of a champion to the digital sort of initiatives that are going on in your organization, and they're specifically trained up to like engage and motivate people in the organization that might be sort of struggling to log on, really.
Yeah, I think that's a good point, Alice. I
Fabulous
think,
and progressive idea. Yeah.
Yeah, excellent. Okay, I've got another one here. I don't have an LMS. Where do I start? Okay, so that's a good question. John, could I ask you on that one?
Yeah, thanks, Paul. That's a good one. I tend to think of bringing in digital learning as a journey, and you can start small and develop. That's an absolutely valid approach. Not all organizations are ready to make the best of use of a full scale LMS straight away. They might need to start small, build on a small scale solution around some compliance e-learning, and then maybe take the leap further down the road once they've developed that level of experience and trust. You know, it requires stakeholder trust and sort of acceptance that this is going to be something that will succeed. So I think that's definitely the right way to approach it for some organizations.
So it's a strategic choice at the end of the day, rather than just buying a sort of off-the-shelf solution.
I think it will be, because it touches on so many areas. It's not just an L&D tool, and it's not just an L&D decision. So it's definitely something that requires a strategic approach.
Okay. Yeah, thanks for that, John. And I guess related to that, there's a question along the lines of how do you manage the operational pressures that introducing a new and potentially complex system into your organization is going to bring you. Alice, could I ask you that one?
Yeah. We have a lot of experience of this, where implementing an LMS can be a kind of a large project for teams, and like John alluded to, they don't necessarily need to be large, all in phase one. Can be phased into different sort of stages what you want to implement, but I think that working with a supplier to be able to understand the requirements of your system, what you want it to do, and prioritize those requirements as well, so that it's not such of a sort of monumental task. I think understanding the implementation plan and the timescales of the work required to do it, but I think that one of the kind of big sort of areas where we find successful implementations is the sort of partnership approach that we have with clients. So a real sort of like honest relationship about what's trying to be achieved and what is achievable in timescales and things like that. So lean on your supplier, I think, is sort of a successful way that you'll kind of you get your LMS in situ, really.
You want a supplier who's going to hold your hand.
Yeah, very much so. Yeah,
absolutely. And sort of touching around some of that, there's a question here around the nature of management. One of the things we haven't mentioned here really is that the whole approach to management is changing because of the way teams have changed and virtualization and all the rest of it. Chris, maybe you could pick up on that as what you think the changes of the way management approaches things and how that will impact on learning.
Yeah, thanks, Paul. I think it's. I mean, there's organisations that there's organisations that value management and have always valued management. Will always, I think, seek to develop their practice in line with the contemporary landscape, and our contemporary landscape environment is one that's centred around this remote hybrid working environment, as we're calling it now. But of course, it will continue to evolve in the future. So I think, those organizations that invest in managers as people managers and not resource managers are well prepared and well placed to continue to develop those managers in that way. Clearly, there's challenges, and many managers will not necessarily have the experience of working in hybrid teams. Many will. Many organizations will have been doing this for a long time. But it's really important, I think, that managers are given the appropriate support. The challenges are understood from the organization, and the investments made to recognize the role of managers may be changing, it may be shifting to what we don't know, because I think it is context specific. What does your organization need? What do your staff need? What does your organizational structure, learning strategy need or want? And then you can start to build that around your manager framework. But I think it's very much a commitment to understanding the contemporary landscape and being prepared to work with the conditions and the environment that we face, and acknowledge the challenges for everybody, not just those people attempting to manage other people, and not just those people attempting to work from challenging places, and not just those people that are attempting to respond to organizational issues, but to everybody. And management clearly has a key role in that.
Great, thanks, Chris. Some interesting points there. I'm just also trying to watch the chat here, so there's some interesting stuff going on in the chat. But just to keep on with that theme really, and moving it into sort of culture. Obviously, learning is a tool for culture change. So, John, how does a learning management system help you measure what's going on in your organisational culture?
So measuring what's going on within the organizational culture obviously can take many different forms, and it will lean partly on the reporting system, on how well your system will inform your organizational hierarchy, and that's your learners themselves, but also the learners managers and also the managers managers. So how well that information comes through, and the clarity and the transparency of that information, how up to date that data is. Those are already key metrics when we're looking at managing the organizational culture from a point of view of the mandatory training, certainly. But I think an LMS is much more than that. And we know from research that learners respond well to being given access to training that they see value in. So in contrast to the push approach that we see on the mandatory side of things, so there's the pull, the curated training, the catalogs that you put in front of the learners that are specific to their job roles that Molly was talking about in her presentation. Those are all really powerful tools that an LMS puts there right at the L&D professional's fingertips. So I would go with that.
Excellent. Okay. All right. Thanks very much for that, John. I know we're sort of coming to the end of our time slot today. So firstly, can I just say a big thank you to Molly for an excellent presentation, but also to the panel for helping with some of those questions there, and also to the audience. Thank you very much for coming here today, and thank you for the questions that you put in. If you've responded to the poll about having a further demo, we'll be in touch with you, but you can always get in touch directly with us, and we can arrange to talk to you further. We really appreciate your time today. We realize how busy everybody is, but we do think learning is very important for an organization and its culture, and we really see ourselves as an organization that can help you in the health sector with your learning and compliance. So thank you very much, and have a good rest of your day.